Hi, my name is Samantha Mertens and this is CPR 101. The first thing you want to do if you come upon a scene that you have an unresponsive victim is to ensure that the scene is safe. The scene is safe, so the next thing I want to do is come to my victim. Sir, are you okay? The patient is still unresponsive, so the next thing that you want to do is actually look, listen, and feel. So you're going to come over to the head, tilt the head a little bit. You're going to look for the chest to rise. You're going to listen for any breathing, and then you're going to feel for a pulse. There's no pulse, patient is still unresponsive. So you're going to call 911. If you're alone, the best thing is to call 911 immediately. If you have someone with you, just have that person just go call 911 for you. So once you have 911 called, the first thing that you want to do is give the patient a couple rescue breaths. If you have a pocket mask, you can use a pocket mask. Or if you have a barrier as a something like a shirt, you can use that to prevent fluid exchange between you and the victim. So you're going to tilt the head back, head tilt, chin lift, and you're going to open the mouth and you're going to give a couple rescue breaths. And you're actually going to be checking for the chest to rise and fall. And if the chest doesn't rise and fall, that usually means that there's an obstruction. So when you open up the mouth, you ensure that there's nothing in the mouth. If there is, you actually would take your finger as a hook it inside the mouth, and remove the foreign objects that are in there. Once you have determined that, you do give the 2 rescue breaths. Once you've given the 2 rescue breaths, you can start, you will actually check for a pulse again. There's still no pulse. So at this time you want to start chest compressions. You keep the head tilted there. You want to come over, actually look for the xiphoid process, which is the tip of the sternum, and go 1/3 of the way up. Put your hands together and you're actually going to give 30 compressions to 1 rescue breath. So you're going to go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Once chest compressions are done, you're going to come back over, look, listen, and feel. Still no pulse. You're going to give another rescue breath. Then you're going to go back to chest compressions, and you're going to continue this until the EMTs come to take over for you. If you actually have a second person with you, it's easier to have that person standing by the head giving the rescue breaths while you administer the chest compressions. The person doing the rescue breaths, sometimes what you can do so the person giving the chest compressions doesn't get tired, you can actually switch. After 2 minutes of chest compressions, you'll just rotate this until EMTs come along. When you have an infant, a lot of the times what you want to do is hold the infant by the chest here, use your 2 thumbs, and actually do your chest compressions with your thumbs. What you want to do is continue the CPR, the chest compressions, and the rescue breaths. A good way to ensure that you are administering correct chest compressions is the person that is standing by the head can actually check for a pulse while you are giving chest compressions. You'll continue this until, like I said, EMT comes along and can take over for you. And again, just to recap what you want to do, the first thing that you want to do is ensure that the scene is safe. Once that is done, you want to come to your patient. Sir, are you okay? If you have an infant, you can actually click the bottoms of their heels, and if they're unresponsive, the first thing that you want to do is look, listen, and feel. You want to look for chest rising, listen for breathing, and feel for a pulse. You want to give 2 rescue breaths at first. Well, actually, I'm sorry, you want to call 911, make sure that the EMTs are on their way to take over for you. The next thing you want to do is, like I said, give your 2 rescue breaths. Once you do your 2 rescue breaths, You're going to start with chest compressions. Like I said, right up above a third of the way above the xiphoid process. And then you want to continue this with until the EMTs arrive. It is easier to do this with a second person, but if you don't have that person, you just continue until EMT has arrived. Thank you for your time.